Hey everybody, it's Dr. Eric Balcavage, and we're back for another episode of the Thyroid Answers podcast. And it's not just another episode, it is the 200th episode. And because of that, my friend, my colleague, Dr. Kelly Halderman, the co-author of the book, The Thyroid Debacle, is back on the Thyroid Answers podcast. And we're going to talk about some of the big questions that have come up over the 200 episodes, 199 previous episodes that we want to cover today, like what we've talked about, what we've learned, and what are the hot topics, and maybe some thoughts on some of the hot topics that are going on today. So, Kelly, welcome back to the Thyroid Answers podcast. How are you today?
I am great. And congratulations, Dr. Eric, 200 episodes. I mean, time flies, right? But like, what an accomplishment. So I want to congratulate you because you have offered so much information in these 200 episodes. So this is a shout out to you and the podcast and all the hard work that you've done. I appreciate you and all the listeners appreciate you. And so this is so cool that you invited me to sit down and go through some, like you said, some hot topics. But when you started this podcast, let's rewind. Did you ever imagine we'd be here talking about a thyroid recovery revolution? Because that's what it is.
No. Initially we started doing the podcast just to have an outlet to have a discussion about how I was thinking about thyroid differently than maybe a lot in our functional medicine space, and definitely different than the allopathic profession. And honestly, I didn't know where this process was going to go, but obviously there's enough listenership and enough people following the podcast to have kept it going. But it's been a blast. I've learned a lot. I've changed a lot in some of the things I think about, and maybe the direction I think things are heading. But I do think that the big message is, and I think people really want that, is they want to stop managing their thyroid physiology with lab value, managing the lab values and managing it with med, and start really asking, how do I recover from this process? Because nobody's really focused on that in allopathic medicine. It's all about management. And even in the functional medicine space, to a large degree, the focus is still on management and not necessarily recovery.
Mm-hmm. Right. It just feels intuitively wrong. I mean, being a person who learned the allopathic model and then, ended up getting diagnosed with a terrible neurological disease, and knowing that this symptom management, it doesn't cut it. It doesn't really improve the quality of life. It can sometimes, that's kind of interesting. We'll go into that, but really, looking at the revolution of this, again, it's just something to congratulate you that you didn't see coming, but that, again, intuitively we know as patients, and you had Hashimoto's as well, is that being handed some medications and things, we're not getting at the root cause. It doesn't make sense. And so you've really empowered people over, including myself, over the 200 episodes. And the question I have for you is, what's the most surprising thing you've learned from your, erudite listeners over these 200 episodes?
I think one of the biggest things I've learned and continue to learn is that there's just a lot of frustration with what we're being told and the strategies that are being provided. And yet so many people are still stuck in thyroid purgatory. Like, they're better than they were without medication, but they're not where they want to be with the medication. And so they don't know what to do. And the messages are confusing. And I think even after 200 episodes, there's still confusion, especially from the motto we talked about in the book, that, hey, this is not broken physiology. It is an adaptive response to an excessive stress load. And putting more medication into the system can manage lab values. It can manage symptoms, but it will not often lead to recovery. And recovery means different things for different individuals. Obviously, if they didn't have a thyroid gland, they're going to need thyroid hormone replacement. For some individuals, it's going to mean I need some thyroid medication, but it actually works. I'm not just stuck in purgatory, I actually feel better. I function better. My metabolism's better. I don't have all the chronic signs and symptoms. And then for a lot of people, not only do they maybe need a lot less medication than they were provided, but a lot of my clients wind up not needing medication over time. That's recovery. But you could be recovering any one of those models, but where most people are is they're stuck in purgatory.
Yeah, I totally agree. So if you look back from episode 1 to now, what's the biggest shift you've seen in how people talk about thyroid health on social media?
I wish this story was different. I'm not a huge social media person, but from what I get when I'm on there, I wish actually wish we'd move the needle further along in not talking about optimization of labs with medication, but the optimization of thyroid physiology and labs with the appropriate strategies to reduce the overall stress load, shift from somebody from allostasis back to homeostasis where communication can reconnect, inflammatory mechanisms are downregulated, metabolism starts to improve. Then I don't think we're there yet. I think it's we still have to push this model and try and get it out there into the wide web and ether so that more people start to say, there is another option other than what's being done traditionally in allopathic medicine and the management model in functional and integrated medicine.
So would you say people are asking better questions now, or do we
I
still see
think
that
people are
same
starting to ask,
confusion?
I think people are starting to ask better questions because of the information that's going out there. The
Mhm.
problem is there aren't as many people answering the questions because I don't think as many people in this space are thinking from the same paradigm, right? Like
Mhm.
we wrote a book, The Thyroid Debacle, based on a paradigm that we look through the lens of the cell danger response instead of broken physiology, adaptive. And people hear the message, they read the book. I get messages all the time. I have your book. I read your book. People listen to the podcast. I get messages about the podcast. The challenge is that they go to their practitioner who's providing T4 or T3 or combination, and they try and explain what they're hearing, but that clinician or practitioner is not in the same paradigm. So they're like, I don't
Right.
know. So now the person's confused. They resonate with what we're saying. That's one of the big things I hear from people is I really resonate with what you guys wrote in the book. I really resonate with what you talk about on the podcast and on your Thyroid Thursdays and your posts. But how do I get my clinician to understand what you're saying? So, but I think more people are coming, asking the question and looking for recovery. So I think that part's good. The confusion is, how do we get there?
Right. And we are going to talk about the practitioner certification course that you have in the works. So to really look at that need where you're providing the information, it's resonating, then they go to their provider who doesn't speak that same language. And so when you're telling something to a practitioner that is not aware, it's not their fault. They're just not aware of this paradigm. And then again, then you have that frustration. So you're going to fix that problem too. So in your next celebratory, maybe 300 episodes, we'll have more of you out there, of the practitioners who can understand this. And I think again, that's where we're building bridges. We're here to build bridges. And again, I was trained in the allopathic model. That's okay. But I knew that again, that it really wasn't helping me. And you kind of have that idea of it being again that intuitive feeling where the medication, yes, okay, it's here to help, but sometimes it's not doing its job. And so that's great. And we'll get into that. But let's kind of do a deep dive. Let's go through some of the data behind recovery, if you're cool with that.
Sure,
All right.
absolutely.
Okay. So, Dr. Eric, you mentioned that about 70% of your patients experience recovery, but I know people listening are thinking, like, what does recovery actually look like, right? So, can you paint
Yeah.
that picture for us?
Yeah. So we did a little assessment of this a year or so ago, and I went back and looked over the last 3 years, like how did patients change? And so over a 6-month initial process of working with clients, my average client improved their symptoms that they came in with, their primary complaints. The average improvement was 71% improvement of patients in that 6-month period of time, while reducing, in many cases, the load of thyroid medication and other medications, reducing their supplementation load, and improving their labs. And so again, when I talk about recovery, someone might say, well, I'm always going to need thyroid medication. It's possible. If you've had a lot of atrophy, if you've had a lot of atrophy of your gland's been destroyed, you might need some. And that you can still have recovery, because if you need 88 micrograms of T4 and 5 to 10 micrograms of T3 to replace what a dysfunctional gland or a removed gland can no longer make, but you convert that T4 to T3 appropriately, your levels of circulating T4 and T3 are appropriate, your reverse T3 is not too high, you don't have patterns of tissue hypothyroidism and signs and symptoms, that's still, in my model, a recovery model.
Mhm.
If you can still be a person who needs, you know what, my thyroid gland's been damaged over the last decade and a half, and I need 40 micrograms or 50 micrograms of T4, and I feel good, I function good, I converted good, I don't have patterns of hypothyroidism in my general labs, that's recovery to me. And so there are people who in time may no longer need thyroid hormone replacement if we actually address the root issues, restore homeostasis, then their glands in many times can start to recover. It takes time based on each individual. But really the most important is if we provide them with enough thyroid hormone T4 between their gland and the medication, can they convert it appropriately? If they can, that's still recovery.
Right, exactly. So how is that different from what most people experience with traditional thyroid care?
In traditional allopathic model, the focus is on optimizing a TSH. And so it's generally thought that we just provide enough T4 to bring TSH into somebody's range, whatever that clinician's range is. It may be within the lab reference range. It may be less than 2, less than 3, less than 1. You know, there's standards in the guidelines, and this, where we think people should be. But clinicians have really their own set points many times just based on their clinical experience. But the general belief is that we're treating people who are in homeostasis. The only issue is their gland stopped working, and that everything else downstream is in a homeostatic state. But the reality is the patients aren't. And that's why it's why patients struggle in that model. The doctor has done the job he's been taught. You were in this model. If somebody's TSH is lab high and their free T4 is normal, they're subclinical. We don't treat them yet, because if we give them too much thyroid hormone too soon, it can create problems. They wait until TSH is lab high, many times above 6, above 10, before they really start prescribing. And the goal in many models isn't even to restore T4, it is to restore TSH. And there's way too many things that can influence TSH that make it less valid. But that's their model. And it's, for some people, it works fine. They're good enough, right? Whether they feel well or they're in purgatory, but it's good enough, that model works for them. In the functional space, we tend to say, okay, there's more to thyroid physiology than TSH and free T4. And we've shifted to just looking at free T3 and reverse T3 as well, and antibodies. And the goal tends to be in a lot of, not everybody, but a lot of people in the functional and integrative space, is optimizing T3 to what they feel is an appropriate set point. So if we can get T3 into an optimal range in the blood, they believe that restores cellular physiology. And that's assuming, again, that the body is broken and it forgot how to convert T4 to T3 somewhere along the line. And so they think that if they give T3, it will restore cellular physiology, and it might help somebody change signs and symptoms. If they are in homeostasis, providing some T3, especially if the gland's dysfunctional, can be beneficial. But if they're not in homeostasis, they can optimize a blood level without optimizing the cells and the tissues. And there's implications from both models that providing too much thyroid hormone in a person with allostatic regulation, the stressed physiology, while it can temporarily change some symptoms, there's a potential cascade of problems that can develop.
Definitely. So that segues perfectly into my next question, because I know you see this on social media, Instagram and Facebook. The question of, my labs are normal, but I still feel terrible. What's wrong with me? So it's out there. That's common. We just talked about that. We're optimizing numbers, and the patient is not in homeostasis; they're in allostasis. So what do you tell these people?
I I tell them if they have normal blood work, they have hypothyroid signs and symptoms, and they're not on medication, then we need to not just look at what the value is, the set value, but we have to look at how well you're converting the inactive hormone to the active hormone, T4 to T3. What does your cells and tissues favor? And then are there patterns, even though the thyroid panel looks normal, if that conversion is not optimal, then we want to look to see if there's evidence with that as signs and symptoms, but as abnormal lab values or patterns of tissue hypothyroidism in other aspects of their labs, not just a thyroid panel. But if somebody feels and functions hypothyroid and their labs are normal, it's inappropriate,
Mhm.
right? And so we still need to figure out why. And it's usually the thyroid physiology is not the problem in many cases. It is the alarm. It is the signal. Just like inflammation gets blamed as being the problem, inflammation is the adaptive response. It is the defensive response. And yes, inflammation doesn't make us feel good, just like reduced conversion of T4 to T3 and low circulating T3. But suppressing the immune system, while it may feel good temporarily, doesn't fix the underlying issue. Our job, and we talked about this in the thyroid debacle, was what's contributing to the excessive stress load for this individual, not based on a set protocol, but based on this individual, and how do we reduce or eliminate that load? And when we do that, that's the secret sauce to restoring them back to homeostatic thyroid regulation.
Yeah, and you may have touched on this, but why do you think that disconnect between the labs and symptoms is just so common?
I think the big disconnect is how we were all raised in medicine. From a clinician standpoint, we were kind of raised that this is the range. If we're in that range, if the value's in that range, everything's good. But a lab value could be normal and appropriate. It could be normal and inappropriate. It could be abnormal and appropriate, and it could be abnormal and inappropriate. We need to interpret. Too many clinicians are too busy reading. And from the client standpoint or the patient standpoint, they've been sold a bill of goods in all aspects of medicine where we've said, if we optimize something, we've restored well-being. And that's just not true. It's not true if you have high blood pressure and we give you blood pressure medication. We normalized your blood pressure or returned it to a maybe safer range, but we didn't touch what caused the high blood pressure to begin with. We didn't see, is it a magnesium deficiency? Is it an emotional stress issue? Is there blockages of the arteries somewhere? What is it? What is the cause? We manipulate it, just like statins, like close to 50% of the US population is on a statin. Just because we lower the cholesterol levels doesn't mean we address the reason cholesterol was elevated to begin with. And in much of the literature, it shows that we didn't even reduce the risk associated with cholesterol getting oxidized, because we're looking at markers that don't really relate to what's going on in the physiology. So we've been sold this false information that manipulating lab values into range so that the blood value is appropriate correlates with optimal cellular health, and it just doesn't.
Right. All right, so let's switch gears a little bit, but obviously right on the topic, but let's talk specifically about your cellular hypothyroidism approach. So if someone's hearing this for the first time, how do you explain why their cells might not be using the thyroid hormone appropriately and properly?
Yeah, and this is all really based on the work of a gentleman named Dr. Robert Navio, who wrote the cell danger response papers. And he kind of outlined a whole bunch of danger uh, theories, hypotheses, and kind of compiled them all into one big model called the cell danger response. And so for somebody who's new to what we're talking about, we typically operate in one of two sets: our cells, our tissues, our body in general, in one of two states. We're either in homeostasis, which is a state where I make enough energy from the food I bring in to run all of the cells of my body, all the tissues, all the systems of my body optimally under my given load of stress, right? Because everybody thinks, well, I can't have any stress to be healthy. No, when we're healthy and in a homeostatic regulation, we can manage a ton of stress on our physiology and still recover and still be fine and still function. But when there's an excessive level of stress, and that can be triggered by just general everyday life chronically building up over time, our diet, our nutrition, our relationships, our life stress, or it can be triggered by an infection, an organism, a toxin, and an acute situation. Once the cells have sensors in them that sense a threat or danger or a lack of resources, they activate this state called allostatic regulation, where they say, whoa, there's not enough energy to run all the systems of the body because I got this new threat that I got to deal with, and that's going to take a bunch of energy. So because I have a limited amount of energy, I'm going to slow down regular metabolism, the things that aren't important for survival, and I'm going to downregulate those, and I'm going to upregulate the immune and the inflammatory system to go out and find and get rid of the threat, which is great. We've all experienced it, right? If you have a viral infection or a bacterial infection, or you have a really severe stressor where it just, the body goes into recovery, like danger mode. I'm going to find it. I'm going to kill it. I'm going to get rid of it. And then we go into recovery mode and we come back to our homeostatic regulation. But when we're in this cell danger response, this allostatic regulation, the shift, you're going to be symptomatic. You're going to have decreased digestion. You're going to have decreased hormone regulation. You're going to have decreased detoxification. You're going to have decreased glucose regulation. All of those systems are going to be down regulated to a degree. So because the body's saying those things right now aren't important, I need to survive. So we ramp up the immune system, we ramp up the inflammatory system, we increase blood flow to potentially brain and big muscle tissue, and we ramp up the sympathetic nervous system to be like, I am ready. And so we then start to, unfortunately, experience systems in these other systems that aren't as important for survival. And we start to have symptoms as well from the systems that are being overly upregulated. Brain, number one, right? So we start ramping up the brain. We have anxiousness, anxiety, irritability, insomnia. In time, with as it's ramped up, we get brain fog and we get this overall fatigue. Our muscles can start to have some challenges and problems, like our big muscles, because under stress and danger, we're designed to fight and flee and try and get away. And so we get increased muscle tension, increased muscle tone, spasms and things in the musculature, weakness of the musculature, because we're like this. And that's the response that most people are in. And I think the reason it's important for people to understand that is that when we're in this allostatic state, you shouldn't be surprised that your digestion's compromised. You shouldn't be surprised that your sleep is compromised, your rest, your recovery, that you're anxious or depressed. These are all the consequences of being in this cellular stress state. And along with that, they need to understand that well-intentioned medication may normalize a blood value, but it won't optimize a cell and tissue level if you're stuck in that state, which most people are. And one more caveat to that is well-intended supplementation strategies may not work the way you want them to. They can manage signs and symptoms just like medication might, but you're never going to restore gut physiology if you're in a chronic state of if your physiology is stuck in this chronic allostatic state. You can do any number of gut protocols and that may change signs and symptoms temporarily, but it's not going to recover. Like you finish that support supplement protocol and you go, I was good when I was better when I was doing it, but now I'm not doing it and the symptoms are coming back, right? Because you're still in this stress state. And so it's not that supplementation can't work. It's not that medications can't work. But when we try and force them into a system that can't use them at a cellular level appropriately, it looks like failure, and it actually can be more symptomatic and more problematic in time.
Yeah, totally agree. Would you say that allostasis, the synonym would be sympathetic overload, or can you kind of tie that together? People are kind of aware of parasympathetic rest and digest, sympathetic run from the tiger. Can you kind of give us the similarities between homeostasis and allostasis, or how they're similar, how they're different? Because that just came up in my mind. Maybe someone else too.
So I think when people think about these terms, they're terms that are kind of big, goofy, like I don't even know what that means. But when you're in homeostasis, think I'm in cellular connection mode. My cells are connecting, my cells are communicating. I'm in muscle building, I'm in hormone creating, I'm in detoxing mode. So when we're in homeostasis, you're in cell healing, cell restoration, cell connection, and communication mode, which is critical.
Mm-hmm.
When you're in allostasis, your cells are in defense mode. They're not in communication. They're not in connection mode. You're not in healing mode in that situation. So when we think about cellular homeostasis, we think life is good. There's a party. I'm making everything I need to make. I'm feeling good. My cells are communicating. Just like COVID's a perfect example of this. When COVID came out, right? Everybody went into defense mode, right? They went into their homes. They didn't communicate with other people. They just stayed in their little hole, and they lost communication with everybody. You couldn't, and people were losing their health in that process because they've lost the communication with the people they care about, the people they work with, the people they love. And that creates a lot of stress and tension on the physiology. You'd see marriages broke up, relationships are destroyed and damaged because we lost this communication with the bigger community.
Mm-hmm.
And we need to be in communication with people in our community, our friends, our family members, our loved ones. And when we have that communication and face-to-face interaction, we're a healthier society. But during COVID, we went from, hey, having that homeostatic relationship with everybody in our community to now being in a silo, non-communicating, in defense, and it created a whole host of health issues. So I'm not sure if I tied that to what the point you were,
No,
but
great.
I think it's just, that's what I think about when I think about allostate. How can we relate that to everyday life? How were you when you were before COVID? How were you during COVID? And how as people broke out of that, like, I'm getting outside, I'm not wearing the mask, I'm going to go talk to my friends, I'm going to go hang out with them. People, their personalities came back, their joy came back, their health started coming back because they were now communicating and connecting with others.
That's great. That's great. Okay, so you mentioned there are a plethora of cellular stressors that you can see, like blocking thyroid function. Will you talk about, in your experience, what are the most common cellular stressors that you see that are like blocking that thyroid function?
I think my mind has changed on these things a bit, but I think there's the, the foundational 5 things are, to me, the most important things for everybody to consider. What's my mindset? And you have to have a healthy mindset. And this is a little bit different from emotional fitness. I'm talking about mindset fitness. I can be sad. I can be angry. I can be depressed. Those are emotional responses to the environment. But if somebody has a mindset that I'm sick, I can't get well, my immune system is attacking me, nothing works, that is one of the biggest hurdles for us as clinicians to help them overcome. And if we don't make that, if you have a belief that you're going to be sick, that you can't recover, that your body's attacking you and there's no way out, it's hard to get those people better. I mean, we both know Bruce Lipton and have heard Bruce talk, right? And, you know, this was the biology of belief that he talked about almost 3 decades ago. And it was like, at that time, it sounded woo-woo, but now today it's like, yeah, if I believe something, it doesn't mean just because I believe it, it's going to happen. But if I don't believe that I can get healthy, and if I don't believe I can get better, and I don't believe, or I believe I've done everything and nothing works, that's a person who's going to have a hard time getting better. So that's foundationally for me, we have to work on somebody's mindset. Number two, there's there's lots of disagreements about what we eat, but foundationally, and we've talked about this multiple times, eat the closest to a whole food based diet as you can. You feed your gut flora. What you're putting in is either going to have a positive or negative effect on your overall health and what you eat. And when you can't stress about every little teeny tiny thing you eat, like, oh my gosh, that could have a toxin. Oh my gosh, this could have that. Oh my gosh, this has this. But think big picture. 80% of the time, am I eating a whole food based diet? If you are, take pause, chill. If you're not, just start doing that, right? Start reducing some of the crappy processed foods that are out there. So that's a really important point. Physical fitness, I think you'd agree with me, that is critically important. If you don't move, you're deteriorating. And exercise does a lot. If it's not excessive, but you got to do some, and you can do more as you become more resilient, as you start to get healthier, but you have to have some level of physical activity on a daily basis. And a lot of people, they think they have physical activity, but then when they really look at it, they don't move much. And then I would say sleep is critically important. And a lot of us take that for granted. I know I used to take it for granted, 4 hours of sleep a night. I thought that was a badge of honor. Like, I'm tough because I can do it. And then you find out that's probably contributing to my illness. And then the last of the foundational things that are really important is really just start looking at the habits that you have, the things you do on a daily basis. So many people are worried about the bug, the organism, the toxin. I'm like, what's your habit? Like, what do you do every day? Well, I get up, and I go right to my email, and then I have a cup of coffee, and then I'm tired, so I have a second cup of coffee. And if you just look at their habits through the day, you could look, before you worry about the organisms, before you worry about the toxins, start looking at the habits. Do you have a habit of exercise? Do you have a habit of eating healthy most of the time? Do you have a habit of getting a good sleep system and pattern and habit in place? Do you have a healthy mindset habit? Like, what are your habits? Many times people never really think about what their habits are. Like, why don't I have habits? Yes, you do. But you're not aware of them until you actually write them down and go, oh, is that a healthy habit? No. Okay, what can I replace that unhealthy habit with? I'm on social media 6 hours of the day. Oh, that's probably not contributing to your overall health and well-being. What could you take an hour out of that and add a healthy habit or healthy lifestyle factor? Could you work on your breathing? Could you work on your quiet time, like mindset? Could you just take an hour out of that? Yeah. I think many times it's the things we just don't realize we do or don't do every day that sets the stage for chronic health issues. There's a lot of other things and there's a lot of discussion. And I think we micromanage. Is it Lyme? Is it mold? Is it this? Is it that? If it was just the organisms, and for some people it can be, but other people are living in those same environments. Other people get some of those things and able to get it and recover. So what's the difference? It's their state they're likely in at the time they experience those things that determines how they respond to them. You know, so I think that's how I would answer that question.
Great.
What's your thought?
Yeah, definitely. I think that you said it all. I totally agree with you. And as much as humans, I think we want something very simple. We want, here's this supplement or here's this pill, and then we don't have to change a darn thing, or we don't have to evaluate ourselves. It's like tough love, but that's what's going to move the needle. You can't skip over all the things that Dr. Eric just said. We can't skip over them and then expect to have this perfect health. I think that it really is, even for me being a patient, it was recognizing that I can't get around these and the only way out is through. And so evaluating those habits, evaluating, was I getting enough sleep, all of those things, it all makes the biggest difference. And so I totally agree with you, Eric. And something I also agree with you about is the optimal lab ranges, and really looking at how you've moved away from them. And that's popular now. Functional medicine now has their own optimal ranges. So we're moving in the right direction, but it's still controversial. Can you
Mhm.
explain your reasoning why you don't just focus on the highs and lows in that optimal range level?
Yeah, I think we generally, when we were in the early phases of um, functional medicine training and practice, we were looking at people in the lab range and saying they're still within this lab reference range, but they're symptomatic. So that maybe that range is too wide. So we said instead of two standard deviations away from the midline, maybe half a standard deviation or a one standard deviation would be a healthier range. And it sounded good on paper.
Mm.
But as you start to do that, and this happens a lot in the thyroid world, where we feel like, okay, the range, the lab value, the lab range that my medical doctor is looking at is really wide. This person's got a free T3 at 2.8. That's below, or that's within the lab reference range, but they still have hypothyroid signs and symptoms. So we'll just give them thyroid medication and keep giving it to them until we get them into a range where they say, okay, I feel better. Okay, now we're going to set that as our new range. People start to feel better in here. If I give them too much, then we see T3 at this level. Maybe that's symptomatic. So we'll dial it in. But it made sense initially, but when we really think about it, the lab values are just a picture in time. And really looking at an individual lab value out of context with the whole big picture doesn't really tell us the story. It's a page in the story, but it's not the story. And so I think we have to do a better job interpreting labs as a whole, especially in the functional medicine community, to say, even if a value is high, let's say a TSH is functionally high or even lab high at 6, is that the problem? And the answer is often no, it is not. That value is abnormal, but it might be appropriate for the person sitting in front of me. And if I force that value into a lab reference range, is the person healthier? And oftentimes they're not healthier. We've manipulated into range, but it hasn't really changed the physiology. So I look at some of the times where I've said it, and I listen, even when we talked about it in the book, we put it in the book, like, here's maybe what optimal ranges should be. If you feel well and you function well, you might be in that optimal range, but just because you're in the optimal range doesn't mean your cellular physiology is working. You could have inflammation that's suppressing a TSH into an optimal range, and you still have tissue or cellular hypothyroidism. You could be taking excessive amounts of T3 to optimize it, and it's suppressing TSH. But if you don't care about TSH, or your doctor doesn't care because they're only worried about T3, they may not be aware that, yes, I've optimized one value into a range, but I've actually thrown other lab values totally out of range. But we've siloed down thyroid panels and said, okay, we're going to look at just this piece that I care about, and I'm not as worried about what's going on, that we'll consider that something else. But that's what allopathic medicine does. And we give them a hard time, and we're doing it in this functional space, saying we have to jam the values. I think for the patients, the most important thing to understand, couple most important things to understand: your lab values are rarely ever the actual problem. Where if your sodium's low, just take more sodium. That's not the issue. The labs tell an astute practitioner the story of what's going on with your physiology. Somebody who's focused on management, they'd want to see just a marker or two that they care about and not look at the big picture, because they're trying to optimize a lab value. And what I think a true functional practitioner with a functional mindset, doesn't matter what they call themselves, but if they're looking at labs and saying that's elevated, let me ask the question: why is that lab value elevated, and is that appropriate for my patient? Yes. Then why would I suppress that? If TSH in a person who's got thyroid issues is elevated because they have decreased conversion of T4 to T3, that should tell an astute, functionally based practitioner the body is raising TSH because the conversion's bad or it's down-regulated. They have a choice. If that's the case, and that is an adaptive response, does giving them more T3 fix it, or does it just suppress a value? If they say, you know what, that TSH is high, your T4 is normal, there is enough T4 in the system, but your cells and tissues aren't converting it. Now we need to figure out why. I think that's really what we should be doing from a functional medicine standpoint. And so you can have values out of the functional range and you're perfectly healthy. You can have values all in the optimal range and you're totally unhealthy. So the range is kind of a guide, but it's not absolute.
Exactly. And I think there's a lot of functional medicine practitioners who are, maybe they've moved over and they used to be more traditional, or maybe they've started off and they're functional, and they do these reports, right? Like they get this blood labs back and they have these reports, and sometimes there's supplements connected to the report. And so I see almost like what you're saying, going in and asking the question why. They're not even asking it. It's like, oh, your iron's low, so here's your iron product. When it's like, why don't we ask the question why? Why is the iron low? Is there gut dysfunction? Or, your B6 is low. Here's a bunch of B6. And so that's just kind of word of caution, is that we can do better. We know better, we can do better. And what Dr. Eric is saying is that, reading the highs and lows, even in a functional medicine report, and then just supplementing without asking the questions, without digging deeper, is really a disservice. And so that's just my stance on that, is that the highs and lows, again, we're kind of just like we talked about, greenwashing of medicine, where we're looking at some things may be appropriate. Like a patient, for example, had a higher TSH and she's in her 70s, and her doctor wanted, despite the fact her free T4 was fine, wanted to put her on medication. And you had explained to me that when you're older, you need that TSH to push to make that conversion. So again, it's like, if you take it one step further, if we're learning from Dr. Eric and reading the Thyroid Debacle, we're going a step further, that actually, again, will help you not just mask symptoms, not just take more medications, more supplements. So I think that's excellent, Eric. And then,
I do want to say one thing on this
yeah,
point, Kelly, though. Sorry to interrupt you, but I want to make sure that people understand that even though I come off like a hammer sometimes and say stuff, I don't think there's bad intent.
Mm-mm.
I don't think anybody has bad intent. Everybody's working from within their own lens and their own paradigm. And what I probably need to do a better job of is for, especially in the functional medicine space, is acknowledging that everybody's got a strategy, and for some people that strategy is working, and just provide that understanding that there's something else going on here if you're interested, so that I can help the practitioners not feel like they're getting beat up by me saying, well, that's wrong, right? Because they're doing it they're doing their best under the model that they understand. This is a much different model than what you're getting in allopathic medicine, and to a large degree in to some degree in the functional medicine space. And that's where I need to kind of, how do I help practitioners? But I don't think your practitioners doing it with bad intent. Like, I'm going to really get this person. They're trying to
Yeah.
make you feel better. They just may not understand the paradigm from which we're looking through, and which science really seems to be moving towards, is this, something's happening. These mitochondria, these engines inside your cells, are sensing danger. And I think Navio's work that came out, maybe is it 10 years ago now, was kind of like, but I think it is gaining more and more traction, just like some of the models of autoimmunity are starting to lose favor, and we're starting to see a shift in what we think triggers immune issues and autoimmunity.
Yeah, and I think you do a very eloquent job of, I mean, you're not judging. You're literally taking any practitioner, anyone where they're at, and you're providing information. And so I too, I think that people are where they're at. They have no bad intentions whatsoever, and that helps a lot of their patients. But I do see where we can level up all together, right?
Hmm.
We can level up and start to just dig into what else could be going on here. And I think that's what you provide, and you provide it in a nice, gentle manner. So keep, we're like this podcast right now. I think that it's just great information, and it's we're all just trying to evolve, like you said, as the science evolves.
Yeah.
So let's put a bow on that one and move on to some hot topics in social media, if you don't mind. Are you good with
Sure.
that? Okay.
Yep.
So, gut thyroid connection is everywhere on social media right now, right? People are posting about their SIBO, their leaky gut, their food sensitivities. Where should someone actually start?
Yeah, I think for the vast majority of people, it starts with those foundational things we talked about before. Um, and for the person who's doing all those things, because I get them, the people that come to see me, I'm eating a whole food based diet, I'm exercising, I'm doing all the things that I'm aware of. I would say the big thing to think about is, one, let's make sure we're not over medicated. And I've done a couple of Thyroid Thursdays and I maybe a Thyroid Shorts podcast on gut function, thyroid medication, how too much, too little has an impact on what goes on in the gut from a dysbiosis, a digestive standpoint, a GLP-1 standpoint, which is the craze today. But if you've tried a lot of things and nothing's working to move the needle, I think we have to start thinking, and this was really a bit woo-woo for me, but Kelly actually introduced me to this idea of something we talked about in the book, and that was really the subconscious piece, and the MAP method. And for a lot of people who are struggling to make positive changes with their immune system, with the conversion of T4 to T3, with gut function, gut physiology, whatever the condition is, what goes on in your mind, consciously or subconsciously, is going to have a massive impact on your gut physiology. And so if you're a person, and I've had a couple conversations this week with patients who, in the beginning, there's a lot of mental, emotional, mindset issues going on, but they're not necessarily ready to hear that voice or hear that message. But I've had a number of clients who are like, they finally come to the realization that the elephant in the room is their relationship with their spouse, their relationship with they hate their job. They, um, what happened to them in the past. And consciously or subconsciously, that program is continually running in their brain. It is causing chronic danger signals. It's not a bacteria. It's not a virus. It's not a toxin. It's the mind. And people go, oh, so it's all in my head. It's in your head, but it's not in your head. It's happening in your mind. And what we think about, the physiology adapts to. So if we're conscious or subconscious thoughts are telling your mind that I'm in danger, I'm fearful, I'm in trouble, you're going to get downregulation of gut physiology, downregulation of T4 to T3 conversion. You're going to have inflammation. So I know the craze today is, oh, you got to take my GLP-1 antibiotic, or I've got the secret antibiotic or probiotic that's going to help you, or this is the drug, this is going to get you there. All of these things have the potential to change your physiology short term. They all have consequences with them. And if you don't deal with the elephant in the room, which isn't a 16th gut protocol, it's usually something else. And that's why when we wrote the thyroid debacle, we talked about this in writing it. We didn't put a supplement section in there on purpose. I know people ask me, like, why wouldn't you guys put what are the best supplements? Because I don't know what the best supplement is for you. And what most people do is they go pick up the book and they go to whatever the supplement section is and they start taking them. But I think we were in pretty much agreement that the foundational things were the most important.
Mhm.
And I know you said you really had a positive change in your physiology when you did some of the MAP work with Madeline Lowry. And as much as I was like, Kelly, come on, woo woo woo, but I have sent or introduced lots of my clients to Madeline, and they have done dramatically better because of the mindset work. So I think it's a huge piece. I mean, Joe Dispenza's out there changing people's lives in a week by getting them to change their mind and their mindset. And so I know you were specific about the sexiness of what's going on in the gut. But I think that's the result of, in many cases, and not the problem. It contributes to a problem, but I don't think the gut problem is usually the starting point. Unless I went to Mexico, I drank the water, I got a parasite. Like, okay, that's the beginning part. But for too many people, they're carrying around all of their life stressors like a heavy rucksack through life, and it is weighing them down, driving the cell stress response, down regulating their gut physiology, creating low stomach acid production and pancreatic enzymes, leading to dysbiosis, and that's contributing to their chronic gut issues and obesity issues and inflammatory issues. So that's how I'd answer it.
I love that. Yeah, and I too was a skeptic when it came to MAP. I mean, I like science, I like data, and so you're talking about quantum energy and things. So I was like, I'll try it, right? So there's no placebo here because I was like, how in the world is this going to work? But I had a change in my Aura Ring data. I had subjective changes, and I will add in 2025 I've started to do emotion code, which again is treating not the physiology but the emotional aspects. Because if I don't, I just figure if I'm leaving something behind, I could take every supplement in the world, I can do everything right, I can eat a perfect diet, but just like Dr. Eric said, those are going to take you down. They're the elephant in the room. So wanted to add, that's another one of my new woo woo tools that I'm using, and I'm getting a good response out of that.
And there's lots
um
of techniques, right? There's lots of
yeah,
techniques, and
sure.
everybody's going to need to find the one that resonates with them, but don't discount what's going on up here. I have a client, a relatively new client who's been through a lot of functional practitioners and has had severe anxiety since they were a young child. And yeah, everybody's optimizing they're optimizing that, and she's still anxious. And she's like, well, one of the conversations, why do I have chronic reflux? And I'm like, because you're in a state of fight or flight chronically for 2 decades or more. You're not, you're always in, unless you fix that piece that's wound your limbic system up like the biggest bicep muscle you've ever seen. There's no way your gut is ever going to restore to physiology. You're not going to restore conversion. You can take all the thyroid hormone in the world, it's just going to make you more anxious and more edgy. You got to calm down and unpack that what's been driving the anxiety for so long. You gotta, and real stuff happens to people. So I'm not making light of it. I know you would never do that either. But you have to, somehow you got to man it. You have to do a better job of reframing it and either leave it go, reframe it and leave it go and move on and just say, hey, that was a time in my life. I learned a lesson from that. I'm going to make changes moving forward. But find a strategy so that you're not dragging all of that with you constantly. And even though you say, but it's been that way my whole life, it doesn't have to be your future.
Right. Right, exactly. Okay, great. So let's move on to the medication debates, if you're good with.
Yeah.
Okay. So medication debates, they're so intense online. T4 versus T3 combination, using natural desiccated thyroid. People are, it seems like they're switching all the time, trying to find the sweet spot, following this influencer or this doctor and their protocol. What would you want them to focus on instead?
I think for the person who's interested in a recovery process and not a management process,
Mhm.
the number one thing that they need to consider regarding medication is, do I have enough T4 and free T4 in the system, in circulation, to be available to convert between my thyroid gland and my medication? Be less worried about the TSH, be less worried about the T3 and free T when you're thinking about medication. Focus, unless you've had your gland totally removed or you're on a full replacement, like you've totally shut off the gland. In those situations, I would say, yes, you may need 5 to 10 micrograms of T3 because you're not getting any of that from the gland. The gland usually makes 5 to 10 micrograms. And my recommendation typically for clients is, don't take it in one dose, take that in a split dose, because that'll ride the highs and lows. But if you're taking 75 micrograms of T4, it may be too much, it may be too little, it might be just right. If you have enough T4, let's say your total T4 is 6.5, 7, but your TSH is still elevated, you don't need more to suppress TSH if you want recovery. You just need to have enough T4. And people might say, but my reverse T3 is high though. Okay, well, or my T3 or my free T3 are low. Yeah, that's the story we need to uncover. We don't need to hide it. We need to say, you have enough T4. Your body knows how to convert it if it wants to. It doesn't want to because there's some type of stress response going on. So make sure there's enough T4 in the system, not excessive, not too much, not too little, but enough. And if you want to talk about optimal ranges, yeah, okay. Is there enough is it in the optimal range of T4 or free T4? But I don't, I shouldn't have even said that maybe, but is there enough? So you look at the lab reference range, you look at the in the optimal range maybe, but is there enough T4 available? If there's enough T4 available and you want recovery, don't take so much to force a TSH into a lab range. And if you're a person who's taken T3, this is my opinion, everybody's got a different opinion. If you're taking less than a full dose of thyroid medication to fully replace the T4 the gland would make, and your T3 is low, you don't need to keep trying to take T3 medication to optimize the T3. It's a slippery slope because you can feel better and then it doesn't last, and then you feel better and it doesn't last, and there's issues that go with it. But I don't think in my world that the average person should probably need more than 5 to 10 micrograms of T3, because my focus is, let's make sure if the person has a dysfunctional gland, We replace what the dysfunctional gland can't make. And then if there's still reduced conversion of T4 to T3 or still low T3 or free T3, then that's what our job is to fix, help them fix, is find out why it's not converting, not manipulate it. That's what I would tell most people. Like, and don't be worried if your T3 is 2.8 and somebody says, well, the optimal range is 3.5 to 4.5. That's if you are optimally healthy. That's if you're in homeostasis. You are not. If you were in homeostasis, you would need the T3 because the body would convert it anyway. So that's where I would put it.
Yeah, I think that's great. I think the way you explained it, it really helps patients understand that medication isn't the magic bullet. It's really like not, putting more in the system isn't just going to magically tell your cells that are in that lockdown mode that, we should be converting it. So I think that's a great way that when we talked about that analogy too, is that more isn't better. I know we're Americans and we think more is better and, we're going to force it. But I think that, you really did a great job of talking about why you just keep chasing and switching medications. It's not the answer. That's not the answer.
Listen, I wish it was, but for the vast
Yeah.
for a lot of people, they can't find it. They're just keep chasing this mythical dose that's going to work. But if you if you if you're in homeostasis, 5 or 10 micrograms of T3 to replace what the gland would have made, appropriate levels of T4 to compensate for what the gland can't make, that should work, and it should work fine. You should feel good. You should function good. Your lab should look good. All of the labs in general.
Mhm. Okay, let's talk about a Facebook issue or even Instagram issue. I know you
Sure.
see these too. I see people posting their lab results in Facebook groups and asking strangers to interpret them, or even like asking ChatGPT to interpret them. So, that's a slippery slope and danger. It can be, misleading as well. So, what questions should they be asking their doctors instead of strangers in computers instead?
Well, the I think the person who's going on medication should ask the question, what are we trying to achieve? Like, what are we achieving with this therapy? Are you optimizing a lab value, or are we fixing what caused this? Like, are we doing a management strategy, or what we're doing allowing me to recover my thyroid physiology? What are we trying to accomplish? If they say, well, I'm trying to optimize a lab value because that's going to restore your cellular physiology, how are we going to determine that? Well, because the TSH will be normal, or the T3 will be in the optimal range. But you're manipulating that into the range. So how do we know that we've restored cellular thyroid physiology? And see what they say, right?
You're going to
If
get
they
deer
say
in the
we're just going to,
headlights look, bro.
but if they just say, well, we're just going to look at this lab value and that's it, then you're not on a recovery strategy. You're on a management strategy. If they're not going to look at other lab values other than a thyroid panel to see how that thyroid medication is actually working in the cells and tissues, then you're on a management path. And if that's not what you want, you need to find somebody who's going to help you recover. If somebody says you can't recover from from hypothyroidism, Hashimoto's hypothyroidism, you're not on a recovery path. You're on a management path because that person doesn't believe you can recover in the first place. And I've been doing this 30 years at this point. I've had plenty of people recover their thyroid physiology, hundreds, way more than that probably. And again, based on the model, a lot of people don't need thyroid medication. And the other thing, and I know you understand this part and realize this too, that many times that people are put on thyroid medication with good intent. They see a less than optimal lab value and they're symptomatic and somebody puts them on the medication. And that starts the road to more problems because it just winds up on more and more because the body's trying to get rid of it, what it didn't want. And once people start, once somebody does do a good job in interpreting the labs and making the shift to a more appropriate dose for recovery, what clients often find out is man, I'm starting to feel better with less of this stuff. I'm not as
Mhm.
anxious. I don't have as much insomnia. I'm sleeping better at night. I still don't feel great, but I don't feel like I'm wired and tired at the same time. And there's a lot of these clients, and I don't prescribe, but I give the recommendations to the clinicians and tell them why. But as we get down, we often find that a lot of the people never needed thyroid medication. Their gland can make it, but they were prescribed it because of the conversion issue or an elevated TSH because of reduced conversion. And then once they're off the medication, they're dramatically better. And now they're like, but I'm still symptomatic. I still have some signs and symptoms. Right. Your thyroid gland makes enough thyroid hormone. Now you need to use that low T3 without the medication manipulating it. The medication's out of the way. If they've been able to come off of it and get weaned down, now let's go back. What is contributing to that load that's causing this reduced conversion? But that's a different model. And so you have to ask your clinician, is this a management strategy or a recovery strategy? And see what they say. And then I think the other question is, I don't know how but I would ask the question, would you expect the medication's going to work the same for a person who's in homeostasis versus allostasis? And that they may not be like, I don't even know what you're talking about. But the intention, if they're not even thinking about that, and they can, then they're going to be totally focused on managing a lab value and not as concerned about your signs and symptoms down the road, because they're going to make the assumption, of course you're in homeostasis, we'll just give it to you. But if they don't, if they go, yeah, it's going to work differently based on your state, then they won't be as focused on potentially manipulating a lab value. They'll be more concerned, what are the remaining symptoms, even though we've given you this med, and we need to figure out why.
Yeah, that's great. That's great. And I think that that gives patients a voice so they can advocate for themselves and be clear about what they want. Do they want a recovery strategy? Do they want just that management, and really look for themselves, like what are they searching for, right? Because they're two different strategies. I mean, you've helped me recover, right? And so I've been able to get off my thyroid meds altogether. We addressed all the cellular stress. It takes a while, but that's what I wanted for myself. And so we can work together to again give patients give people the words to help them understand more, again, take control of their health care, because healthcare really, primary care starts with the care we give ourselves. And that rolls into my next question about stress. Stress management content is huge. Every time I open up my social media, it can be all the options of, there's devices that can help with stress, there's meditation apps, there's just breath works, we could do cold plunges and saunas. But I feel like I myself and maybe some other listeners, I get stressed out about being stressed because I'm trying to manage it. So what's your advice for me and for the listener about how we can prioritize this and help tackle stress and not get stressed about being stressed?
I think there's a couple simple things you can do. One is you've got to be, this sounds woo, but you got to set your intention for the day and your schedule for the day, and you have to learn to stick to it. Like, what's the plan for the day? If you don't have a plan, then you're taking on everybody else's burden as your priority. So you have to have a plan and a script for the day. Like, what's my goals for the day? What are the plans? How am I going to do the day? At least the vast majority of the days a week. I could see like on the weekend, hey, I'm off. We're going to just kind of free flow through the weekend. Great. But in general, how do you reduce the stress? You got to schedule your life and your time for health, not for everybody else's priorities. So I'd say that is one of the first places to start. Number two, most people don't need any type of device to manage stress better. And I think we talk about stress as it's a terrible thing. We need stress for growth and development. So it's not about the stress, it's about your resiliency. So when things happen, if you have to be okay with saying no. You have to be okay with scheduling your day so that you load it with all the work that needs to get done as a priority, plus includes your health habits. And one of those is just, I fully believe, is having time, carve out time for yourself, quiet time for yourself, not social media, not everything else, just quiet time for yourself where you can listen to the noise that's going on in your head. Um, and that is, that's a huge thing. And then when you start to hear what those messages are going on in your head, then you have to start reframing them or asking better questions. Is this really my problem? Is this really something I need to do today? Is that somebody else's issue? Is this something that's a priority for me? And if it is, then it gets put on your priority list. If it's not, you have to be okay with saying, that's not my priority, right? Well, my kids they need me to make their lunch for school. No, they don't. Your kid can make their lunch. You need to teach them how to make their lunch, but they can make their lunch. And that just freed up 10 minutes of your time that you could do something that's more productive for you. You're not being selfish. You're actually teaching them a life skill. I have to do the wash. Just wash all over. No, you don't. You can teach your kids how to do that. You can teach your spouse how to do it. Now, everybody has different roles in the house, but we make excuses many times for that we or I have to do it all, but you don't. And and I think sometimes that's a defense strategy, so you don't actually have to listen to the noise that's going on in your head. You fill your life with everybody else's busy stuff, so you don't actually have to listen to the noise that's going on in your head. And then once you start listening to those messages and you start thinking about, and you have that quiet time to really reflect, you you need to start. I think we need to all learn how to start reframing the situations. We've all had terrible situations that have had happen to us in life. And, I've said this many times in the podcast, my own personal life, I've had a lot of things that happen that are very negative things on my life. And early on, they contributed to my excessive stress load and some of my health challenges early on. But in time, I started learning how to just reframe the situations. Bad relationship with my parents, surprisingly, they just showed up the other day, and I hadn't talked to them and like really had a conversation with them in 10 years. But I was dragging their challenges, their problems, their dysfunction along with me and all of the things that happened. But at some point along the way, I said, I'm not responsible for them, their behaviors, their actions. I don't have to bring them into my world and be responsible for it. And their thoughts about me and their beliefs about how I should be and how I should behave are their issues, their problems. And I took the issues, some of those really negative consequences, and I just reframed them. Like some of the really negative and traumatic things that happened, you can look at those and carry those around and worry and just kind of keep thinking about how terrible it was. But what I had to do for my own health and well-being was saying that was a terrible situation. I didn't enjoy it, but I am who I am today because I learned from that experience. I think I'm a better parent today than I would have been because of how my parents raised me. I'm taking the good stuff and the bad stuff, and I'm changing the direction of my personal life, my fitness life, my dietary life, my social life, my relationship with my wife and kids. I see what wasn't good, and it's allowing me to change. So while there was a lot of trauma in those things, and I'm not dumping, everybody's got a worse story than somebody else, but I had to reframe it. Otherwise, it was tanking my health. And once I started reframing all these bad experiences into how can I learn from that and turn it into a positive for my life going forward, man, that was huge. And I just had a conversation with my brother recently, and he said, when people hear the stories, they're amazed that we came out this way. But that's because I think one of the things it did for us in our family, I've got a brother and a sister, and we probably growing up, we weren't as close as we could have been, but we are as close as siblings could be. And our families are that close. But because of the chaos of growing up, we had to circle the wagons and protect each other. And
Mm,
that bad relationship has turned into 3 siblings who have very tight relationship, and who's all the kids have have a very good relationship and see the benefit of family and communication. They look at what my parents missed out on. They're like, how could they do that? But they see what's happening here. So I would argue with everybody. Yes, you have a story to tell. Yes, it was traumatic. Yes, it was terrible. But find a way to reframe the situation, because that then impacts your subconscious to move you forward in life and leave go and forgive, right?
mm,
It's not like you forget, but you can forgive them. They have their issues, their own demons, but I've got to deal with me in my life. And how can I take these experiences, good and bad, and project them and be better tomorrow?
right. I love that. And I just heard yesterday that one of the best biohacks that we really should use more often is forgiveness. And I was like,
Mm-hmm.
whoa, that hit me like a ton of bricks. And like you were saying, there's an element of turning that misery into your mission, you know, breaking the cycle, making sure that you're seeing not just this as like all this happened to me in that victim mentality, but like turning it and seeing like the gift in it, like this is what I want to be in contrast to what I went through. And the forgiving is for the forgiver. And so I just think that is one of the most powerful biohacks is reframing and seeing the gift in some of our the trauma and not just carrying it around and having us weigh us down. And then of course like just using it to upgrade yourself and not like having it be that subconscious, that thing that's driving you down. And we see that all the time. And it's not just like, oh, I've forgiven everyone, one and done. It's like this is life, right? Like things
Mm-hmm.
happen to us all the time. And so it's just a constant reminder of what we can do with situations that may seem like they're there to take us down. We can really level up again from them. So really nicely put, Eric.
And I think that we should touch on that one more. Just because you forgive them doesn't mean those people need to come back into your life,
No, exactly.
right? Like
100%.
we've had conversations where, like, I'm a very black and white person. If you're good to me, I will do everything I can for you. But the moment that I feel somebody crosses me, I'm done, right? And I lost a really good friend a number of years ago because of something that they did. And I had friends say, like, can't you just forgive them? I'm like, I did forgive them, but I don't need
Right.
that type of personality behavior in my life. It's not healthy for me to be around that. So
That's
I
right. Don't be a
cherish,
doormat.
yeah,
Yes.
I cherish the time we spent together. We had fantastic times, but the minute somebody shows you who they are,
Yes.
trust them,
Believe them.
right? And if
100%.
that's not congruent with where you want to be, who you are, or where you want to be, it's okay to leave them behind,
That's right. What do they
right?
say? Fool me once, shame on you. Fool me twice, shame on me.
Yeah.
So that's kind of how I learned my lesson is like I'm forgiving and then I'd let the person back into my life when they've shown me who they are.
Hmm.
Just is going to happen again. So again, like you said, like forgiving doesn't mean again letting that stress and that being a doormat come back in on you. I think that's really healthy to give thanks for like we had some great times. It was great, but then this is where I draw the line. Those are good boundaries, and a lot of your listeners are women, and we need better boundaries, ladies. We
Yeah.
really do. And so, great point there.
Awesome. Were we,
All right,
how,
so
we, we got to start wrapping this puppy
yeah,
up.
we do. We do. Can we hit on a little bit of nutrition? A
Yeah.
little bit.
Let's go.
Okay. Lots of advice out there, conflicting. Do keto, don't do keto. Do iodine, don't touch iodine. You know, goitrogens like back and forth. How do you cut through the noise? We kind of already talked about
Any,
this, but
yeah,
let's do it again.
any
Yeah.
diet can
Yeah.
change your physiology temporarily, right? But
Yeah.
ultimately, don't don't fall trapped to any one of the food fads, food religions. The primary focus for everybody is start with a whole food based diet 85% of the time. Some people would say, well, you should do it all the time. I think especially our industry has created a lot of fear around food. You can't eat gluten, you can't eat rice, you can't eat dairy, you can't eat this, you can't have eggs, can't do this. And just the fear that some food is going to poison you creates part of the stress load. Okay. So just focus on a whole food based diet. I had a disagreement with somebody the other day. We're like, but shouldn't it all be organic? Shouldn't it all be, do you know what's in some of those foods there? Still have toxins. I'm like, look, we could make that argument about every single freaking thing. And where do we go? Nowhere. And we just frustrate people. So eat whole food-based diet. I'm a believer, try to eat in season when you can, locally grown. If you can buy it organic and it makes sense from an organic standpoint, great. But there's all kinds of noise that even the stuff that's organic and that's what's put on those could be challenges and problems. So just focus on eating a whole food-based diet 85% of the time. And you could say, well, what about pasta? What about this? When I say whole food-based diet, eat the food as close to as it came out of the ground, off the tree, out of the water, or out of, off the ground, whatever it is. But just eat as close to natural as you can, right? If it has to be processed, it's probably not on your 85% of the foods I want to eat on a regular basis.
Awesome. Perfect. Okay, so a lot of people are sharing transformational stories, but we do hear a lot of people sharing that they've tried everything and nothing's working. And we did talk about this kind of earlier on the podcast, but just to kind of recap, like what separates those who recover from those who stay stuck? And we did, talk about emotion and other things, but if you just kind of want to summarize that again, I think that's such an important point.
Well, I think, I hear that all the time when people come to see me. They're like, all right, I've done everything and nothing works. I've seen a lot of people and nothing works. What are you going to do different? And I'm going to say there's a couple things. One, you have a belief that you've done everything that you're aware of. The biggest thing that has probably not occurred is somebody hasn't really worked with you to identify your state, the state you're in. Are you in homeostasis or allostasis? If you've done everything and nothing works, you're not in homeostasis. There's no way you'd be fine. So you're in an allostatic state and you're doing everything you're aware of and your doctor's aware of, but you're probably treating yourself with support and your clinicians are trying to support you as if you are in homeostasis, and you are not. If you want to succeed, you have to believe that there's another option out there. There's something I'm not uncovering. And I think you have to come from this from a point where my body is not broken. It's not trying to kill me. I just need to identify what's creating that stress. And for so many people, it is their mind and their mindset and the emotion that's winding up their limbic system that's not getting them or allowing them to get into a system where we can shift from cell danger, right? The allostatic regulation, to cell communication and connection and repair and heal. And I can't tell you how many discovery calls where I have people tell me that. And when I tell them, I'm like, look, we got to look at your lifestyle factors. We got to make sure you're not over medicating, over supplementing, but there's something here. And many times it is, they're not dealing with the elephant in the room. They're not ready to discuss it. I had just recently had a client and she's like, you know what? I think it's my relationship with my spouse. I'm like, we talked about it before and it wasn't an issue. It is. Yeah. Well, if you're living with that person day in, day out, and you're subconsciously angry and upset about them day in, day out, you've done everything. You're sensitive to supplements. You don't tolerate medications well. Like, it was never the supplement or the medication. It was always the elephant in the room. That was the biggest thing you needed to tackle, which is, what's going on with my relationship that it's creating fear, danger for me. And sometimes people aren't even aware, but there's something there. And you have to believe that there's still something that needs to be uncovered. And you have to be open to the idea that you aren't doing everything. That's what I would say.
All right. So let's wrap up by talking about the future of thyroid care. So, based on everything you've seen, Eric, over 200 episodes, 20 years of experience in your practice, where do you see thyroid care heading in the next 5 years? And what gives you the most hope about the future of thyroid treatment?
I'm hopeful that we'll start to see thyroid physiology and health in general from this model that I'm proposing, that this model that Dr. Navio and others are proposing, that we're not broken, right? That there's the body's responding, adapting to something. And I'm hoping that with the help of other functional medicine practitioners who think like I do, we'll stop trying to manipulate labs. For the people who truly want a recovery strategy, we'll stop trying to optimize labs and manipulate them into range and call that healthcare. And instead, we'll say, look, there's enough hormone, in here. We've got to get busy identifying what's contributing to your excessive stress load. So we'll do less management, more recovery. And I think that's how not only do we move thyroid care forward in the future, but we'll move healthcare forward in the future. And with people like you and other people with like mind, we need to start or continue to get this model out there in a way that people who already feel like this is it, that we can get them to start opening their eyes and potentially kind of pull the blinders back a little bit. Like, there's something else. There's another way to tackle this process. And it's more beneficial for the client. It's more beneficial for overall healthcare. It's more beneficial for you as the clinician, because you're not just focused on manipulating values, but you're actually providing true healthcare, both in allopathic and functional medicine.
Yeah, and you're developing that certification program to train other practitioners. And I was going to ask you what's driving that decision, but you really kind of laid it out and the need for it, the need for that education.
Yeah, I mean, like, I can't see everybody, and I need more of a clinician community who can help move that model forward. Like, I'm not the be all end all. I'm always working to try and figure out why this couldn't work or shouldn't work, or why it could be wrong. But if I can get more like-minded people to start to see this as an adaptive physiology model versus a broken model, then their collective mind, your collective mind, the collective intelligence of this whole group can start to really create the movement that changes how we address health care in this country and others. I mean, we've got right now, they're trying to make changes to some degree in what's happening with the healthcare crisis in this country, but really we have to change the thinking from dysfunction, disease, broken, to adaptation is the initial issue, which then can become dysfunction and disease if we don't ever address what we're adapting to. But that's the model we need to change. If we're really going to move healthcare forward, that's really how we're going to do it. So I'm in the process of putting that together. I haven't announced this yet, but I'm probably gonna just start doing some, what did you call it? Open rounds or something. I'll probably allow some clinicians, we'll just do like maybe once a month, do open rounds where clinicians could put they can sign up and for the open round, and we can just hash out labs. Okay, here's the labs. How would you interpret it? How would you interpret it? How would I interpret it? Okay, and start helping clinicians learn a little bit differently in the future. Yeah, I really do want to have the certification process of this thinking process. It's really all going to be built on the kind of the cell danger model, this allostatic homeostatic system, and hopefully We can then train clinicians to help them in this journey, because it's taken me 10 years of working through the process and all the time and literature research and making these arguments for myself and against different things to really get this. And, you know, the way we progress forward is having more people. So when people say, hey, I need somebody in my area, who is it? I don't say, I don't know. I can say, it's Joe, it's Kelly, it's so and so, it's so and so. And I think that's the way I make a bigger stamp on this movement, is not by, as much as I love seeing patients one-on-one, the bigger way I can affect humanity is by helping change the model.
Mm-hmm. Gotcha. So what can listeners expect from the next 200 episodes of the Thyroid Answers podcast?
Yeah, well, I think we're going to continue the Thyroid Shorts episodes, because that seems like it's getting some traction. So those are like 20, 30-minute episodes where I just cover one topic, right? Don't get into too much stuff. Just dig in deep on one topic and get them covered. I have not asked you, but I would like to get you back on the podcast on a more regular basis for maybe one episode in a month to do like this kind of format where we do more thyroid specific stuff. And I think the focus really of the podcast going forward the next 2 months is really going to be to bring in people who think along the lines of this cell danger model, this allostatic regulation, and kind of marry up with some of the principles we talk about in the book. And then also people who have different and unique strategies for improving the level of fitness in what we call those fitness factors. So, okay, how do I improve mindset fitness? Well, then let's just have, if we're going to have a guest, let's have a guest who's going to talk about, here's strategies that I've seen and I've worked through with clients that improve their mindset fitness, that improve their habitual fitness, that improve their physical fitness, that improve their emotional fitness. And we're going to talk about those things. So not only can they pick up a book or get the thyroid recovery blueprint course, but you can listen to the podcast. It's all going to be really focused on moving this thought process forward. So in the past, I've had some fantastic guests, but their belief process and mine were different, and sometimes that creates question. Like, I don't want to say uncomfortable podcast, but I have a tendency to question somebody when they say, this is this. It's my tendency to do it. And I know it doesn't resonate with some people. Some people love the fact that I'm challenging people, but I want to move this movement forward. And so everything about the podcast over the next 200 episodes is going to be focused on how do we educate and move this movement forward, so that when people come to this podcast on a regular basis, they have a better understanding of their own physiology, and then they can share that message, and they'll have the skills, the languaging of how to talk to their physicians, how to talk to their family members, how to talk to their friends, how to talk to their health coach, to make sure that they're on a path for thyroid and health recovery and not just management.
Awesome. And then lastly, but not least, any final thoughts on someone who has followed your work and they're now ready to take the next steps in their thyroid recovery journey?
Yeah, make a decision that you're going to do it. So step one, I can't work with everybody. So number one, if you have an interest in potentially working with me, they can always go to my website and schedule a complimentary discovery call, and we can talk about what's going on and what they're trying to accomplish. If you're a person who's really looking for a management strategy, that's not me. If you're looking for a recovery strategy, it may be me. And then the options for working with me at this point is, we have, for the person who wants more of a self-guided process, I've put together the thyroid recovery blueprint, which walks them through how to self-assess for these 18 fitness factors now. How do I evaluate myself? What are the strategies that I can do to start improving those things? The thyroid recovery blueprint is on the website. They can do that. If they want to work with me, then we'll have that. That'll be a one-on-one type of situation where we'll take you through a more structured, more one-on-one process to help you start to recover your thyroid physiology and your health. And then sometime in the future, hopefully we've got more clinicians that think and practice the way similar to how I do from that same model. And so in the future, it might be like, oh, here's Kelly. She's practicing this model. She's local to you. Go see her. Here's Jane over here. Go see her and find the one that resonates with you. Doesn't mean just
Mhm.
because they're in the program, it's the one for you, but find the one that resonates with you. So that's what's coming up, I hope.
Awesome. Well, congratulations again on 200 episodes. You're a wealth of knowledge. You're an amazing and brilliant clinician, and I'm just thankful for you and all you do.
Well, thank you, Kelly. And I'm super appreciative that of you and that we got to meet, become friends, that you joined me in writing the Thyroid Debacle book, and
Mhm.
hopefully be a big part of where we go from here.
Yeah, awesome.